Hello, everyone. Welcome to Autism Demystified. I am your host, Dr. Vladimir Barriev, autism pediatrician extraordinaire. And today we have a very special guest with us, Anna Marie Dorelien, who is a very close and wonderful friend of mine, and we are in for a treat. I'm going to start out by reading a little bit about Anna Marie's biography, and then we'll let her introduce herself, and we'll take it from there. So, Anna Marie is an alumni of the City University of New York. She's a board-certified behavior analyst, or BCBA, as we call them, because that's a very long word to say, and a licensed behavioral analyst in the state of New York. She's the CEO and co-founder of A Friendly Face, an applied behavioral analysis ABA company with autism treatment clinics in New York City and home-based therapy in all of its boroughs, as well as the tri-state area. A vendor for the Department of Education, AFF provides ongoing professional development and training to staff and parents living in the city of New York. The clinics also serve as a practicum site for all accredited universities, providing BCBA programs to future behavior clinicians. Anna Marie has almost over 2 decades of experience serving children with autism spectrum disorder and other disabilities. She has been involved in global work supporting parents and educators in places like Brazil, Africa, and Singapore, as well as providing educational information on autism and ABA to pediatric resident doctors at a local hospital. Anna Marie was featured in a New York Emmy Award-winning Spanish documentary on autism, and her most recent work providing support to Ukrainian families with children with autism fleeing the war garnered the attention of the local news and community workers. Anna Marie was also honored as a top woman in business in Staten Island. She is passionate about providing support for families with children on the autism spectrum, not only in New York, but all around the world. Anna Marie states, "This isn't just a profession for me. I really do feel that it's my calling and my purpose in life." All of that was such a long introduction because she has done so much, and there is more that would not fit into that introduction. So I would love to say hello and welcome, Anna Marie.
Hi, thanks for having me.
It is an absolute pleasure and honor to have you here today.
It's my honor to be here.
Well, the first question that I wanted to discuss with you is particularly being in the field, having all the experience that you have, the mental health of parents, children on the autism spectrum. What, in your experience, have you seen that stands out to you the most?
Man, so it varies, right? I've had the opportunity to be with parents when they first kind of are grappling with the diagnosis, when their kids are super young. One of my very first kids, actually, that I saw, who was 3 years old and who's now well into his 20s, I had dinner with his parents recently. And to see the evolution of the parents from first finding out the diagnosis and where they are in terms of their mental health, and sort of, I think across the board, just dealing with the devastation of the diagnosis, and where they are now, you know, with their only child in their 20s and sort of like navigating adulthood. I would have to say that the toughest time for sure is when parents are first finding out about the diagnosis. I've seen it like play out in different ways where mothers become diagnosed with clinical depression to extent of separation in the marriage, and most devastatingly, a couple of parents taking their lives. So it is, and I one of my best friends, one of my closest friends is a neurogeneticist who's told me that for some of the parents that they find, the diagnosis of autism can hit harder than the diagnosis of pediatric cancer, for some of the families, and still trying to figure out why this is. But I would say every parent, if not almost every parent, experience a certain level of devastation, and it affects their mental health.
You know, from my perspective, I feel that when I'm in the office giving a parent a diagnosis for their child, the first impression that I get from them, what I hear parents telling me through their body language, through their words, is that sense of loss of what they thought their child's future would look like. It's all of a
Mhm.
sudden changed. So that
Right.
outlook, that future perspective has been shifted. So that's a very real sense of loss that I've heard stated multiple times. But in from your point of view, do you see that those tragic stories of families having a lot of difficulty dealing with the diagnosis, were there risk factors involved? Because it's not that seems to be like in the uh, outer extremes, that a parent would have such an extreme like clinical depression reaction or suicidality.
Right,
Like, were
right,
there
right.
risk factors with those families that we should be aware of when
So
when
I've not really didn't do any research. This is just sort of as you experience it out there in the field, you know what I mean?
yeah.
I would certainly think that you're already predisposed. I mean, for such extreme reactions that I've described, right? I mean, the usual is like sort of crying and breaking down and going through denial and sort of like having this grieving moment. And then you kind of put on your bootstraps and then you roll up your sleeves and let's get therapy done. We're going to go look into the future. That's thankfully a bit more common. I would think that there's already history of susceptibility at least to clinical depression, to get to a point where there's suicide ideation. I mean, I feel like there's already predisposition to that. I also want to say that there's a variable also when it comes to culture, certain cultures and certain backgrounds and religion. Um, we were a part of trying to build the first autism school in Africa. I'm not going to name specifically the African country, but um, for those kids, I mean, they reach out to us in desperation because some of the kids were being chained outside the home and not being like revealed in public. And I have dealt with families in New York City, depending on cultural background, where it's sort of the same, where no one can know. No one can know. No one in their community can know because they will be ostracized. So all of these factors will affect your mental health, a sense of isolation. And depending on your religious persuasion, there's always this, especially with mothers, don't even need to be religious. There's always this guilt and self-blame. I must have caused something, whatever it is in your child. And then when you play in the religious factor, it's like you've been punished XYZ by God, or this is some demonic force. So much the parents have to deal with, aside from just, I now have an autistic child that I have to help.
So there are some medical professionals who also evaluate children on the spectrum who follow our show. And if we were to share some ideas or strategies or approaches to make sure that when we're delivering this news, um, what what sensitivities we should have, and how would you recommend that when this diagnosis is first given, what are the next words that should come out of that clinician's mouth going forward?
Yeah, so I mean, it's interesting. We talk about this like years ago. I was sort of like hoping with some diagnosticians too at Columbia University. I met with them and we sat down. We sort of like were hoping to get into this project of making it mainstream. I reached out to them proposing to make it mainstream for diagnosticians to do an extra step, to not just provide this is the diagnosis for your child, but to also bear the mental health of these parents in mind, and have a follow up with these parents. Just sort of like the focus is, how do we support you and provide the resources to deal with the diagnosis. And hospitals, it's a business at the end of the day, as you know, and then it just kind of like didn't take off from there. But I felt like it was incumbent on diagnosticians, before I see these families, that they start with the support, right? They start with this. And I think it's crucial for diagnosticians to talk about the prevalence of autism, the prevalence of it, so that parents realize they are not alone, and the prevalence of autism across demographics, across culture, across backgrounds, and to say, we don't know yet what is causing it, right? So the parents are armed, walking away. I'm not alone. Nobody knows the real reason, and everyone has this shared experience of like, why me? Part of what I do when I sit down with parents is I turn around and I go, and how are you doing, mom? How are you coping with the diagnosis? Do you have resources and support? In fact, I've included that in our evaluation, so that evaluators are asking that from parents. And I feel like diagnosticians, to some degree, need to alert the parents that this is going to be a very difficult journey for them. That, yes, they might want to go in and help the parents, but it is normal, absolutely normal, to be emotionally and mentally affected, and that there is help. And here are the resources for you, and you are not alone, right? And I just wanted that as standard treatment of care for diagnosticians. I wanted, and I also said, like, when you diagnose children with autism and tell parents for the first time, I feel like a part of your institution, especially a place like a clinic or hospital, should be able to say, and we have a social worker who can sit down with you and kind of help you process this diagnosis. But that's not been, that's my project in life. It's simple, like this is a standard of care. Every diagnostician needs to tell the parents that this is going to be a tough journey for them, and there's help.
Yeah, I mean, a parallel in the pediatric world is we have a lot more of a robust system in this, even though it's not perfect, is that we screen routinely any newborn that comes into our office. We're standard of care is to screen the parents for postpartum depression, mostly the moms, even though postpartum depression does happen in dads and on a less common scale, and then give them resources. There's resources available for support groups and such to take it forward. What in my personal approach, what I do is, I don't think my approach is yet as well defined as well established as I would like it, as how you're describing it, in that I do have a local list of all levels of support for families, as well as, like, if I tell them I would recommend that your child needs to see such and such specialist for speech or physical development or something like that, there's a phone number that I give them with that. So it's like a handout prepared. But I still, even with that handout, I'm not 100% sure that that's quite enough, because what you mentioned is people, like, you give someone a handout with resources. That may not necessarily be enough. It's their state of mind is in a state of shock at that moment. That what really probably would make a bigger difference is giving them a follow-up phone call or a follow-up contact a few weeks later.
Yeah.
Which is is probably something that I'm going to be instituting in my own practice going forward. For new diagnosis, of course. I do see families who have known their child's diagnosis for years. Just they don't necessarily need a follow-up, but for the new ones, that is definitely something that I could add into my work. So thank you for that. You just changed one of my personal clinical practices.
Yay.
Even though, to be honest, I mean, of course, I give all the families my direct email address, so they follow up with me if they have questions on their end. But it's not a proactive follow up. It's like only if they have questions for me, then I will respond to them. But I'm not
Right.
reaching out to them necessarily in a proactive way yet. That is something that I do plan on changing. With the increased, oh, by the way, you just made me think of something when you mentioned the chaining of children in Africa.
Mhm.
Um, you know, we like to think that we live in such an advanced nation, but we've had our own experience here on Staten Island with Willowbrook, an institution that treated children very poorly in the not too distant past of our own.
Yeah.
So we
Yeah.
have had to evolve and take a more humane approach to the way that we help people with disabilities all around this country. What do you
100%.
feel in your career over the past 20 plus years, the awareness of autism and the acceptance of autism in the community for people who don't have family members on the spectrum, has that
Right.
changed the response that families have given when they are diagnosed? Have you seen a change?
Yeah, I definitely have. The biggest change is a personal relationship with autism. The amount of people who can now say, I know what autism is firsthand because it's either in my family, immediate or distant, or my neighbor, or my best friend, or you know what I mean, my in-laws. Um, there's a personal experience now. It's rare. Well, maybe because it's in my field, so it's the people that I, rub shoulders with. But no, I mean, okay, here's an example. In our church, my husband and I lead the couples group for our church, right? We have a very small church made up of maybe at most 60 people. And we have maybe 10 couples that come and meet every month. And out of those 10 couples, more than 50% have children on the spectrum. Like,
Wow.
think about that. That's
Wow.
so wild. Where 20 years ago, there wasn't one. And now more than half. And our last meeting, one of the couples were talking about how they were on the verge of divorce because their son, who we now treat at AFF, was diagnosed with autism. So, like sitting there and hearing that outside the scope of AFF and work and being a clinical director, just one of the members and wives in the church, sitting there and hearing it from that perspective, it was so helpful for me because I got to see what happens behind the scenes in these homes, the difficulties, the strain. So, yes, there is a difference. And also, acceptance, eh, okay, awareness for sure, right? Um, but there's still a whole lot of misconception when it comes to autism. But definitely we are much more aware, we're much more educated because we happen to be much more affected. I used to say, Vlad, it will take one of the big people to help once it reaches their home.
Mm,
These politicians will act once it reaches their home.
mm,
Understanding in schools will happen. Better tolerance will happen in our schools once it affects their home. Because I also do workshops and consult for schools, and the amount of times I have to tell teachers to stop yelling at the children because they're autistic, not deaf. And how our children are treated in the school system, I think to myself, it'll stop or it'll get better once they're affected in their own homes. And
mm.
they are now affected in their own homes.
Wow, that's very powerful. I have to say I agree with you that when it becomes familiar, that's when, especially for the people in power, that is
Yeah.
when things change. That's how people have evolved their views on LGBT rights in the past. That's how
Yes.
people have
Yes.
evolved their rights on
Mental
a
health.
number of issues, on
Yeah.
mental health.
Yeah.
Um, we think about the Kennedy family, the effects that they've had with mental illness, and how that has impacted U.S.
Right.
politics and the way that we have approached things, and the closing of a lot of institutions has
Yes.
been impacted by personal family affairs
Yeah.
of our politicians. Absolutely,
It's unfortunate, but
that's how the
that,
world works. It's just the
yeah,
reality
just the reality. Yeah.
of how the world works.
Just the
There's the
reality.
ideal world and the real world, and we live in the real world.
Hmm.
So I thank you for that very candid answer with regards to your experiences in working with schools and just what we expect to help drive change in the future. I want to change gears a little bit and
Sure.
discuss an article that resurfaces. This question resurfaces about the controversies of ABA in the New
Yeah.
Yorker magazine. Saw an article in February of 2024 discussing how the criticisms of ABA, and we had both proponents in that article and people who oppose the use of ABA therapy
Yeah.
from
Yeah.
very unique perspectives. So I'll just name two of the. I'll give you a couple of quotes from the article, and I would
Sure.
love to hear your feedback. So one is we have Alicia Allgood, was quoted in the articles. It was a board certified behavior analyst who runs an ABA agency in New York. And herself, she is on the spectrum. And she told the author of the article that the autistic community is up in arms. There's a very vocal part of the autistic population that is saying ABA is harmful or aversive or has potentially caused trauma. And then in response, Allison Singer, the president and co-founder, I love her podcast, by the way, of the Autism Science Foundation, believes that the criticism of ABA has gone too far. She says that her daughter, Jody, who is in her 20s, acquired essential language skills in ABA, such as naming parts of her body. And if she had a toothache, she could say tooth hurts rather than screaming or tantruming, with no one having any idea that she needed to actually go to the dentist.
Yeah.
So first part is, can you please just briefly break down to our audience what ABA therapy is, and
Yeah.
then how it has evolved over time?
Over time. So, I mean, I think it's important to understand the history of ABA. It really, Skinner, B.F. Skinner was the father of ABA. It's based on the principles of behavior, right? It's based on the science of behavior. And eventually, it was used as an intervention for people with disabilities to just increase all kinds of skills of significant social degree, right? Um, and that's what ABA is. But I think what happened was in the 70s, Ivar Lovaas, I'm sure you've heard, started using ABA, the principles of behavior, which we know now as ABA, and using DTT and things like that. And he worked with children that supposedly was like hopeless, like they cannot be helped in the mental health community because children with autism were institutionalized once upon a time, right? You're just thrown in, institutionalized. I'm going to segue a bit. In my past life, because I'm Filipino, I used to be a nurse. So I got to be like a supervisor nurse for one of the Willowbrook homes. And in looking back now, I realized that a lot of the population were autistic. Um, they were sitting there. I didn't know what it was at that time, and just like stimming and humming and playing with strings, and some engaged in self-injurious behavior. So they were institutionalized once upon a time. But anyway, this behavior approach, based on Skinner's behavior science, worked, right? Children started to speak, and they started to engage in like social behavior. So out comes this ABA. Um, and there was a mom, actually, I believe she was a psychologist in Pennsylvania. She wrote a book. It escapes me right now. I used to use it years ago to develop programs, but she had a severely autistic child, and she heard about what was happening in California, and like they were using this approach, and she started using that with her child, and her child improved and developed language. But unfortunately, some of the approaches is what we would consider like very punishing, and you know, um, dehumanizing and traumatic. I know I heard a podcast actually from one of the people that were there when Lova started. One of the approaches was if a child started stimming, they hit the child's leg like hard and sharply instantly, so that the child paired that stimming with that pain, and that decreased the behavior. Because look, at the end of the day, and this is what I tell, like, and I'm not diagnosed, but I'm aware enough to identify as someone who's neurodivergent. Um, there are a lot of people that won't like ABA, but at the end of the day, it's based on science. You and I learn through the science of behavior. You can't escape it. So the idea that if a child touches a burning stove and the stove burns their hand, that's ABA in motion for the child. I have an antecedent. I want to touch something. I'm curious about the stove. Now I want to touch it. I go ahead and I touch it. The consequence is me burning. In the future, I will not engage in this behavior. Right? So that's it. That's how you and I learn. I'm hungry. I cry, and I go milk, milk, milk. The antecedent is my hunger. My behavior is I cry milk, 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 milk. My parent gives me milk. I'm now taught in the future, I just say milk and I get it. So behavior science is always taking place. So when people tell me, including doctors, that they don't agree with ABA, I'm like, what are you even saying? That's not really what you're saying. What you're saying is you don't agree with some of its strategies, which I agree with you as well, right? As a behavior analyst. So certain strategies are archaic, and we can use the science. I'm such a believer in the science. We can use the science where it works, and it doesn't have to be these archaic approaches because the science works. Years ago, I'm sure you know Catherine Lord. Years ago, I had a chance to sit down with Kathy, and she was one of the original instructors at Lovas in ABA, and she's anti-ABA. And we sat there together, and she told me about the approaches and how it used to be and how it traumatized her, and she hated it, and she did not want to work with any ABA facility. And then I told her what AFF does. And of course, she wanted to work with me, and we did a project together with Will Cornell, what they were doing at that time. They came to AFF. And she said, "You're doing a different ABA, Anna Marie." I'm like, I am actually not. I'm not doing a different ABA. Yes, we had yoga at AFF. Yes, we had art. Yes, we had sports. Yes, we had group. But we also had the one-to-one DTT moments. But ABA was in motion. ABA was happening. The science was taking place. But we're just doing more shaping and more naturalistic approach with our kids and less extinction. But I'm happy to report that ABA has evolved and the approach has become more and more naturalistic. And I know providers out in the field and advocates in the field who absolutely believe in ABA for their children with autism, barring that it does not apply some of the principles from way back.
Thank you so much for that. That was a lot of, if our
Sorry.
listeners are paying attention, that was a lot of great insight that I have to make comments on some of it just to highlight some of the things you mentioned. Number one, a big shout out to Catherine Lord, because that is one of the authors of the ADOS, the gold standard instrument that I use to this day to diagnose children on the autism spectrum. A huge pioneering figure in the world of autism for children. So the fact that you were able to show her that ABA does not have to be a torture chamber for kids to dehumanize them, that it can be a natural way, is really, it speaks volumes about you. I can't believe I know you right now. I'm that's number one. Number two, you mentioned the more naturalistic styles of ABA therapy. So I'm just curious, at Friendly Face, uh, is it a formal? Because I know there are some formal styles of approaches to ABA, such as
Yeah, yeah,
behavioral
yeah,
response treatment, the early start
yeah.
Denver model, verbal
Right.
behavior, the
Yeah,
natural
yeah.
language paradigm. Are there any formal ones that are used at Friendly Face, or is it discrete trial training, but in a more naturalistic fashion that doesn't have a standardized way of administering that you could speak to? How does it approach in Friendly
So,
Face?
so we definitely do discrete trial. And when we say discrete trial at AFF, we just mean a one-to-one moment with the child, whether on the floor or at a table, where it's more teacher directed. So that is definitely used. But to us, the measure of success is how quickly we can leave that environment into a more naturalistic environment. But natural training is always, it's a part of the package. Like it's a must, right? It's wherever you go, the place just is a reflection of leadership. When I started working as a therapist, and I had to years ago, right? I had to sit there for 2 hours and just do touch head, touch head, touch head, clap hands, clap hands. I mean, I just, as someone with like has it's very little attention span. You and I have worked together. We're like the same personality, right? It was driving me nuts, and I couldn't do it. And then I started budgeting how to do it, that there'd be moments at the table, moments around the house, moments on the floor. There'd be moments to identify rooms in the house instead of just walking. We'd like crawl or bark like dogs to each room, and it just became like, like different ways and more natural ways of teaching skills to a child. So you will see that at AFF. They'll go into groups where maybe they're sort of they're going to be painting, or they're doing an art activity, or they're doing some kind of sports, but they're learning intraverbal skills. They're learning following directions. We've had kids, oh my gosh, I could tell you stories after stories. We've had kids where they started at AFF and they're going, ah! They don't want to be around kids. And slowly but surely, we work on the tolerance of, peer companionship. And then we had one particular kid who went from, don't be around me, to like, where's Joe? I want to play with Joe. Then this desire to play. And parents didn't tell the school teachers that they had started therapy at AFF, and the teachers say, he's starting to go up to the kids and saying hello to them. We're not sure what's going on. So that's what you will see at AFF, sort of just a more well-rounded, holistic way of treatment.
So basically, correct me if I'm wrong. Basically, what you're saying is the difference of being rigid versus being more naturalistic is that with discrete trial training, you could either choose to force the child to stay at the table with you doing the touch head, touch hand, touch head. Here's
Yeah,
your
yeah,
M&M, your reward for touching your
yeah,
head or
yeah.
touching the car, versus let's go play with your toys, or let's walk around the room, or walk and explore things, your natural innate curiosity. Let's
Right.
do that, but
Yeah.
I'll pause at some moments. We'll do touch your head. Yeah, I want to ask you to see if you understood the concept of touch your head, or clap your hands, or give me the red card. Does that sound like the big difference? Does that
So
sound correct?
it will look something like this. And I did years ago, I ran an ABA school, and I kind of was able to experiment on how to do this, right? Where it's just like 30 minutes of DTs, and the rest of the time it's running like a preschool, but it's an ABA school. So it would look something like this. Let's say your child does not yet know how to request or how to even identify a train. And then on a DTT setting, we're teaching him, like, where's the train? This is a train, right? And the child wants the train. And we might say, you have to say train instead of screaming, right? And the child says train. And then, like, we might do that for X amount of time, and then go to the living room where we will have this train that the child loves within the child's view, maybe on top of the television. And the child now looks, and it's more now in the natural setting, right? So now, instead of table and chair, where the child really had to first learn in a discrete way what this is, how I ask for it. And then there's a pivot and how it's taught in the environment so that the child can generalize. And that's pretty much how that happens. But yeah, along the line, as you're walking, you're also bringing this up, like, oh, Dr. Vlad is wearing a hat. Where's your head? Where do you put on your hat? And then Dr. Vlad's shoes are so cool. Where do we put on our shoes? And the child may say feet. And they learn that in a more table and chair before getting to that point. But I think what I'm describing, thankfully, is more and more common in facilities you go to. Whereas I remember starting AFF and thinking, oh, some of my colleagues, if they walk in, I might get seriously criticized for how I'm running the center. But I was ready to debate with anyone. You dare tell me that I'm not doing ABA, because I knew that I was applying the science.
So that's excellent. The other point that you brought up about people feeling traumatized or the negative views about ABA therapy is targeting the right behavior that you want to change. So there are some behaviors which are causing distress for both the family and the child. Then there are some behaviors which don't cause anyone distress, which people, which the question is, do those behaviors need to be addressed?
Oh my gosh, I am so glad you're bringing this up. I've been interviewed on so many podcasts and no one has brought this up.
Well, this is a very special one. I'm here for you.
I'm so glad you brought this up, because this is a huge difference, right? Back in the day, you were trying you were teaching kids in therapy. ABA therapy was to ensure that they stop being autistic, right? So any symptom of autism, you worked on that. You decreased it or make it leave the repertoire. And when I was in the field working, there was just this part of me, this sort of ethical part of me that was like, this isn't right. It's not bothering him to flap his hands. He's doing his work. So why can't he flap his hands? I was that type of a therapist, because I also engage in stimming behaviors, and I knew it would drive me nuts if someone was to stop me. Or why does he have to sit? If we're not working on in-seat behavior, I get it why we work on in-seat behavior, because these kids are required to sit in schools. I get that. But if that's not the program we're working on right now, we're working on, visual perceptual skills and putting a puzzle together, and the kid wants to do it standing up while twirling around a bit. And why can't he do that? Why? Why? I couldn't understand it, right? This is why, when you have all these questions, it's good to finally be in charge, so you do things the way you want to. So to me, I have had, and here's the thing, right? I have had to tell parents, no, we do not have to work on that behavior. It's not impeding with your child's progress. It's not impeding. Of course, you always respect what the parents want, right? You always, because we have this thing in ABA called social validity. But I remember a parent coming to us and their child engage in just full body swing forward, almost continuously. And the mother coming one day, after, almost a year, and saying, Anna Marie, I need to speak to you. My child is still engaging in hand flapping. It's so we went upstairs and I looked and I said, based on data, it's decreased by 85%. Your child is actually self-managing their own behaviors, whenever they're in public. Yeah, but they're still hand flapping. I had to finally say, a friend of face is not in the business of making your child stop being autistic. We're in the business of providing skills that your child needs and working on behaviors that may be in the way. But we are not here to stop them from being autistic, because there is nothing wrong with your child being autistic. I mean, I was incensed at that point because it was clear to me that the mother pretty much was saying, zero stimming. I want my child to have no remnant or no symptom of being autistic. I want my child to stop being who she is. And to me, I have kids on the spectrum. To think that they should stop being who and what they are, to me, is like, what do you mean? You know, they're 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 fine just the way they are. They're perfect the way they are. Yes, we will increase skills because every child needs to learn skills, whether they're neurotypical or neurodivergent. Every child needs to learn that they can't whack you or destroy the room just because they want a cookie. You know what I mean? Whether neurodivergent or neurotypical. But your child should not be anything but they are, you know? So I 100% subscribe to that. I will not, we have parents that still say, okay, work on it. I try to talk to them. I understand, you know, the stigma, and I understand that they kind of bear some, especially depending on culture, but I try to educate them that we work on things that impede progress, right? That impede your child's development. Not because, you know, we're not just going to stop it because it reminds you that your child has autism.
That's beautiful. We are lucky to have a gem like you in this world, working with children who really need all the support in the world because they can't advocate for themselves as much as they would need to get optimal support. So the fact that you have are giving them a voice that they don't have on their own is really touching and moving. And I hope everyone really takes it to heart that the goal of ABA therapy is not to change someone's identity, to no longer
Right.
make them have autism. That's not the goal here. The goal is specifically to learn skills. It's to learn. It's really an
Yeah.
educational approach. That really, you can't say that enough times. You can't say that enough times.
Yeah. And you likewise, when I have parents, it's like they're not demanding more from their kids because their child is autistic. I'm like, no, you know, your child is capable. But I mean, I can talk on these things all day with a million examples. I'm writing a book, by the way. I'm in the process of um,
Oh,
I'm writing a book based on 3 kids over the years that I have worked with, and in the process of me like working with these kids, I discovered about myself. Um,
wow. I would love to have you back on and talk about the book and promote it. Make sure everyone make it an Amazon bestseller on day one when this book comes out, because your experience, your the legacy that you're leaving in this world is priceless. It is invaluable.
well, here's a quick example of it. Is one of the kids that I was talking about would engage in just like this just like kind of uncontrollable behavior whenever he saw tape dispenser, because he had to grab a huge chunk of tape and I couldn't, like, I would not be able to stop him, and he'd just like tear the plays and walk away with this big giant tape, and I would sort of just like give in. You know, I wasn't a really experienced therapist yet, and I would just be like, oh, there he goes. But as I would watch him, I would then grab a small portion of tape and wrap it around my finger, because I too had that impulse that whenever I would see a tape dispenser, no matter where it was or who was looking, I had to quickly grab a piece of it and wrap it around my finger. And when he did that, I remember watching him as he walked away with a big tape. And as I walked away, going back to the therapy room for my next kid, playing with the tape, looking at him and thinking, we have the same thing.
Wow.
So,
Wow. That's very powerful.
yeah.
So thank you so much for agreeing to be a
Yeah.
generous and wonderful guest on our show. Please tell all of our wonderful viewers how they can learn more about AFF and access to your wonderful services.
Well, I mean, they could just definitely check us out on our website, affautism.com. We also have, as you know, a medical facility, which is a whole different topic. But you probably know the website more than I do with that one. Is it AFFA at autism.com? Oh my gosh. What's the other website?
That's a good question. I don't have it off the top of my head, but I promise you one
Okay.
thing.
For ABA, it's affautism.com.
AFF Autism. For the other one, we will make sure to post a link on the page where this video airs. And the audio as well. We'll have the link in the show notes that everyone can follow. So for parents in New York State, navigate autism with confidence. If you are searching for an experienced pediatrician who works with children on the autism spectrum, you can feel free to call my office at Barrier Pediatrics. It is 917-819-5056. And of course, make sure to visit affautism.com as a website, as Anna Marie has mentioned, to learn more about ABA therapy services that you can get for your children. Anna Marie, God bless you. Thank you so much for joining us today.
Thank you for having me. So much fun.
Thank you so much. Bye.
Thank you. Bye-bye.